Now, I think a lot of hip flexors are given a bit of a bad rap. A lot of people hate them, they want to stretch them out, they want to get rid of them. Your hip flexors are extremely important as a dancer. But the scenario that I'm about to explain took me about 10 to 15 years to work out and to really learn how to train in dancers to help this whole complex. So we all know dancers who are really tight at the front of the hip. They will often try and stretch, mobilize, massage, crack, do anything to get more mobility. But again, we need to look at why is that so tight? The area that most people feel it is around here, and they often blame their psoas or their iliopsoas, but we need to look at where that actually comes from. So psoas major attaches up here to the front of your spine. There is a psoas minor as well, not so much effect deep into the hip. So we want to have this psoas major coming forward. It attaches and joins with iliacus, which starts from the inside of the bowl of the pelvis to create our iliopsoas tendon, which then drops down to the inner part of the top of the thigh bone. Now, in normal people, psoas is partially designed as a spinal stabilizer. It will help control this area of the spine. But normal people don't ask their leg to be above their head for half the day. So if we're wanting skyscraping adage, we need to rework the anatomy a little. If we want to release a little bit of the stabilizing role from psoas so that it can work more as a hip flexor, we need something else to stabilize the spine. And this is where those tiny, deep little back muscles, multifidus, intertransversarii, rotatories, tiny little segmental stabilizers come in. If we develop exquisite control of these, it will help stabilize the spine. Also helps give you amazing extensions to the back, but it'll help stabilize the spine. This will allow psoas to just chill out from its stabilizing role. Then if we use iliacus to help center the hip, we can use psoas major to help flex the hip and actually really get that deep engagement so we can lift the leg well above 90 degrees. And this is something that does take time to work on, but I find it essential. And I'd say 98% of the students that come in with issues at the front of the hip, I find issues with the stability in the low back. So instead of just stretching them, mobilizing them, massaging them, we may do that as well, but it must be coupled with some deep stabilizing exercises, isolation of these deep back muscles to help provide the stability. Also, if people have been having issues around the hip for a long period of time, whenever we're doing any of the deep, slow stabilizing exercises, make sure that you're using your fingers or they're using their fingers to have a feel around and note exactly what they are trying to use to fake. They may look totally fine from the outside, but if they're doing their tucks and tilts and they're actually using their superficial hip flexors to do it, they will be constantly building up tension. So it's really important to empower your dancers with the understanding to keep an eye on themselves, to be constantly monitoring with their fingers for excessive tension through the big global muscles, through the hips, through the back and through the abdomen, to make sure that they're not actually faking it and just looking good from the outside, but they're actually getting those deep stabilizing training from the inside.